All right, guys, let's wrap up our discussion on testicular cancer by talking about our non-germ cell cancers. I'm going to put this little orange squiggly here and denote that non-germ cell cancers account for 5% of our testicular cancers. And I want to orient you guys to what this means. Remember, in our testicular overview video, we were talking about that 95% come from this purple population of cells, which was our sperm progenitors, and then 5% of our cancers are going to come from our Leydig and Sertoli cells. Our Leydig and Sertoli cells, we denoted as these orange cells. It was our Sertoli cells that were here nurturing the sperm, and our Leydig cells out here on the periphery that were creating testosterone. So I just wanted to reorient you guys that in this video, we're going to be talking about this orange population of cells, which only accounts for 5% of all testicular tumors. So if we want to go ahead and get started by talking about this, let's start off by talking about our Leydig cell tumor. And Leydig cell tumor is really important to know because it looks very similar to yolk sac tumor, which is a germ cell tumor, which we talked about in the previous video. So I want you guys to be carefully comparing and contrasting the two as we go through this. So in terms of our Leydig cell tumors, they're benign, and they're going to present with precocious puberty or some sort of sign of excess androgens or excess estrogens. And this is because they produce either excess androgens or excess estrogens. And this can present as gynecomastia or precocious puberty or some other sign of excess hormone that's being produced by this tissue. And this makes sense. We know that Leydig cells are responsible for making hormones. And so if you have a cancer that's full of hormone producing cells, you're going to expect some type of hormonal aberration. So like I said, these are going to produce androgens or estrogens. And then on gross exam, these are going to be described as golden brown. And I want to note that this is very similar to how yolk sac tumors are described. Yolk sac tumors are described as yellow and mucinous. And I think that yellow and golden brown sound very similar. So it's important to be able to make that discrete distinction between the two. Additionally, both of these tumor types have eosinophilic inclusions or eosinophilic shards within them. And I want to talk about the key differences between these two. So in our Leydig cell tumors, it's important to note here that this is an intracytoplasmic eosinophilic inclusion that is shard-like. So you'll notice that this pink eosinophilic shard is within the cytoplasm. It's within the entirety of the cell. So you can see the cell is outlining this shard here. Whereas if we look over here on the side, we're going to see this is an example of red blood cells flowing through a capillary, which can look very similar. They're both this really intense hypereosinophilic inclusion. However, you'll notice that these red blood cells are actually flowing through a vessel as opposed to being intracytoplasmic. And this is important to differentiate from our yolk sac tumor, which has Schiller-Duval bodies. And the Schiller-Duval bodies are primitive glomeruli, and they have blood flow flowing through the middle of them. And so the Schiller-Duval bodies are going to look much more similar to this because it's blood flowing through cells. Whereas in our Ranke crystals for this tumor type, we are looking at an intracytoplasmic inclusion. And I cannot stress enough how similar these can look and how it's important to be able to differentiate them. So like I said, Ranke crystal is going to be something that we see in our Leydig cell tumors. Let's move on now to talk about our Sertoli cell tumors. These are also called androblastoma, and these are going to be benign tumors because they are just tumors of the cells that support developing sperm, so they're not going to be producing large amount of hormones. You're not going to expect hormonal change like we expect in the Leydig cell tumors. And these are going to be composed of sex cord stromal tissue, and in terms of the histology, it's pretty simple here. We can expect like this architecture of like the supporting cells. So you'll see that there's these like bands of like architecture throughout this entire tumor that represents the tubules that you would expect Sertoli cells to live alongside that are going to be nurturing the developing sperm. These are the important things to know about this type of tumor. It's really benign. This is a great tumor to diagnose because you know it's going to be an easy fix. There's not a lot of side effects from anything hormonal. This is a great tumor in terms of prognosis. Lastly, let's talk about primary testicular lymphoma. And this is going to be our only non-germ cell tumor that is malignant. So it's malignant, and unfortunately, it's really aggressive. Additionally, you're going to see this type of tumor in your much older males. So a vignette is going to be like a 50 or a 60-year-old male with a testicular mass perhaps some B symptoms because this is a lymphoma. This is going to be a very different presentation from the classic younger male who's in the teenage years or early 20s who's presenting with a testicular mass. And then on histology, it's also going to look starkly different from anything else we've been looking at. You'll notice here on this histology that this is all going to be white blood cells. So these like big blast-like cells, really dark purple, are starkly different from any of the other testicular pathology we saw. So if you got a histology of a testicular lesion, this is what you saw, you should be thinking about this type of tumor. It's going to be the most common testicular tumor in our older males, and the most common type is going to be diffuse large B-cell lymphoma. So in terms of our non-germ cell tumors, it's important to remember these only compose 5% of all testicular tumors. The first two that we talked about are going to be benign, and then our only malignant tumor is going to be our primary testicular lymphoma, and this is going to present in an older male and have this distinct histology that is different from anything else we looked at. I hope you guys enjoyed all this content on testicular cancers. Can't wait to see you guys in the rest of male pathology. Bye!